So this is one of those pandemic controversies that's being argued about all over social media.
It's over the drug for people and animals called Ivermectin, and some doctors are prescribing it to treat COVID, while others say it's dangerous. Still, veterinary doses are selling out at feed stores. Meg Ferris looks at the issue.
In March, Edward Lucarini caught the coronavirus.
I started to feel symptomatic as fever started and fatigue. I was a little concerned because I'm diabetic.
His brother-in-law, emergency medicine physician Dr. Paul Harch, prescribed ivermectin.
Within 3 hours, the fever broke and I had the energy to get up and shave and shower.
Ivermectin has long treated skin and internal parasites. Veterinarians also often use it. Dogs take it to prevent heartworms. Dr. Harsh says studies show it can act as an antiviral agent against COVID and prescribed an exact dose off-label.
I see overwhelming evidence that it can affect patients in a beneficial way in their outcome. An international coalition of doctors has assembled this information from many, many randomized trials.
But other doctors don't recommend it. Infectious disease specialist Dr. Robson Lutz says it's for bed bugs and scabies, not COVID. Ochsner infectious disease physician Dr. Sandy Kemmerly says studies that went viral on the web were done in test tubes with 250 times a normal human dose and were fraudulent.
Number of studies, which has been recently peer-reviewed and published, showed there's absolutely no data to support its use to treat COVID.
Tulane critical care physician Dr. Josh Denson, who's doing COVID research and caring for ICU patients, agrees.
I was talking to someone who was prescribed ivermectin in another state and now is in the ICU on a ventilator. I would not recommend it for me, myself, or my family.
Doctors say it delays beneficial treatments with Regeneron infusions and can be dangerous.
In Mississippi, over 70% of their calls to poison control were from citizens taking veterinary preparations.
But all the doctors agree, don't ever just pick a dose and medicate yourself with anything without your MD's trained advice. Meg Ferris, Eyewitness News.
The Louisiana Department of Health, the Infectious Disease Society of America, the FDA, CDC, and WHO have all come out against the use of ivermectin for COVID.